What do you think are the commonly asked questions in the ESR test section? What medical students and USMLE examinees often ask is, in what diseases does ESR increase or decrease? Today let's understand the principles behind why ESR levels rise or fall, and ultimately learn to interpret the condition based on ESR values. What is ESR? The erythrocyte sedimentation rate is a simple nonspecific laboratory test. It is commonly used to assess the inflammatory response. It's often tested with CRP to get a clearer picture. What does the erythrocyte sedimentation rate measure? Here's how it works. When we put a mix of blood into a vertical tube, the red blood cells naturally settle at the bottom while the plasma rises to the top. It measures how quickly red blood cells collect at the bottom of a tube. Please explain the principle of erythrocyte sedimentation rate test. Normally, RBCs stay apart due to negative charges. But when there's inflammation, proteins like fibrinogen coat the RBCs, reducing their negative charge and causing them to clump together. These clumps of denser RBCs fall faster in the tube, indicating a higher ESR. What do you think are the commonly asked questions in the ESR test section? What is often asked in tests is when ESR levels rise or fall in certain diseases. If something boosts fibrinogen levels, like diabetes, kidney disease, or pregnancy, the ESR can rise too. And if it shoots up really high, it could mean a few things. First, there might be an infection brewing in your body. Second, you could be experiencing inflammation, which could point to conditions like giant cell arteritis, polymyalgia rheumatica. And third, it could even be a signal of cancer, such as multiple myeloma or metastasis. On the other hand, if something decreases fibrinogen levels, your ESR might drop. Now, let's focus on anemia. Why do you think ESR increases or decreases in patients with anemia? When someone has anemia, their ESR can go up. It can be a bit challenging to grasp. If you're interested in learning more about sedimentation, I suggest diving deeper into the topic. But for a quick takeaway, consider this: in certain types of anemia, particularly those associated with ongoing inflammation, the body ramps up production of acute phase proteins like fibrinogen. These proteins coat the surface of red blood cells, causing them to clump together and ultimately raise ESR levels. ESR increases in most types of anemia. Now, when it comes to sickle cell anemia, why do you think ESR increases or decreases in patients with sickle cell anemia? Their ESR can go down. You might wonder why the ESR actually decreases, even though it tends to rise in most types of anemia. This is where rouleaux formation comes into play. Normally, red blood cells stack up like coins in a neat pile, making them settle faster. But in sickle cell anemia, the irregular shape of the cells disrupts this stacking, slowing down the settling process and decreasing the ESR. Other irregularities in red blood cell shape, like spherocytes, can also interfere with stacking and lower the ESR. Lastly, think about polycythemia. Why do you think ESR increases or decreases in patients with polycythemia? Where there are too many red blood cells, the stacking process becomes less compact, leading to a lower ESR. In most types of anemia, ESR levels rise, but in conditions with irregularities in red blood cell shape, such as sickle cell anemia, they decrease.
Thank you for watching. If you liked the video, please hit the like button. If you want to see more videos, hit the subscribe button.